So, right, this meeting is being recorded. This is the meeting of January 5th, 2022. And it's unfortunate if Arlene isn't coming. I forgot about it because I wanted to ask her some questions, but that might not be going to happen unless she decides to call in.
We have a phone number now calling in, so I'm going to admit that, and this might be Arlene.
Oh.
We have a caller. Is this, could you identify yourself, please?
Yes, this is Arlene.
Oh, super. I'm glad you're there. Are you in a car somewhere?
I am. Please let me know if the road noise is intrusive, okay?
Okay. Okay. Well, let's.
If so, I would mute myself if it's bothersome.
Oh, okay. It's not bothering me. Let us quickly, so we can get the business out of the way, approve the minutes of the previous meeting or not. Anybody have a problem with them?
None.
Not up.
Okay. I'll assume that they're good and we'll go with that. Arlene, you probably don't want to stay on the phone indefinitely, so I thought maybe we should jump down to the COVID updates and you can tell us what you know. And you can also tell us about what's the latest on contact tracing. Is that still happening in the normal way when you get a report either from self-reporting or from Maven?
So, no. Not sure what you mean by the normal way, but it is. Let me start with your first question first.
Okay.
There are lots of cases emerging everywhere, including Shutesbury. I don't have an exact count for you, but I'm sure that because people exit, other people are entering it, so it's always in flux. But I've been averaging about 12 to 15 people in isolation at any given time for a while now. And I have a feeling it's under support because there likely are positives that were a result of a home test, where especially over the holidays with new caravanners being closed for PCRs, a lot of people were turning to home tests, and not everybody's been reporting them, I'm sure.
Right.
So 12 to 15 known cases at any given time. Two are elementary school students. Luckily, what with the holiday break, they were not in school during their infection period. The contact tracing for tests. And what DPD says is that if somebody has a positive on an undocumented home test, one that was not overseen by any clinical person, then if they reach out to us and let us know, or if we hear of it here now, then we need to be on isolation advice. We encourage them to seek a PCR for confirmation, but that's something hard to, get an appointment. And we ask them to notify their own contacts, and we help them understand what is definitely close contacts, and encourage their close contacts to get tested. And we are not asked to do formal contact tracing on the basis of a home test only.
Got it.
Okay.
Okay.
Meanwhile, also for officially documented tests, they're cutting communities a little bit of slack, if you will, because they recognize the CDC is gone, so that's not a resource, and a lot of communities are just swamped. And so we are being told, as far as contact tracing goes, to focus on the situations that have a lot of risk for spreading in a, like outside of a household. That in school, remember to call long-term facilities for any sort of group setting that's likely to spawn a cluster. Those are the ones that we should be focusing on. And household situations, help them understand, like if it's a situation, help them identify who might fall into that category and ask them to be in touch. They are not asking us to create cases and link them in Maven to the source case anymore.
Okay.
To your question?
Yeah, I think it does. I was thinking about one of the responses to our message last week when we first showed a high number of cases, and people were saying, well, are these linked to a particular social event? And should we know about them? And presumably, if they were, the people would have contacted them.
Yes. Everybody I've spoken with, although you can't prove who you picked it up from, but virtually everybody, it was a family member, it was household contact. Visitors to their household or people whose homes they visited. So there's been no relationship outside of households. There's been no relationship one household to the next. But I did see those queries around, some fearfulness on people's part that there was some common exposure and that people were starting to be, they're being worried about, should I be concerned that I was also at that event, right?
Right.
And I answered the ones that you forwarded along to me. I did reply to them and told them no.
What I was thinking about is, when we come to do another message to kind of explain this process so that people won't start worrying in that way, that they will have some confidence that if infected people, if people who turn out to have been infected were at a social event, that they would then contact the other people there, but that we wouldn't, because that's if it was a home test and so on. Just kind of explain that the situation, the procedures, so that people will know what to think about, and also maybe remind them that if they're worried about getting exposed at a social event, they shouldn't be at those social events, for God's sake. What is the matter with people?
Yes. Well, the problem is that if it was a social event, let's say there was some musical thing at the AC, right?
Yeah.
And somebody believes they may have been exposed there. Well, they don't know who all else was there. They don't have the attendee list. So the infected person is not, in a case like that, they are in no position to notify all of those contacts. That would be a situation where we might want to put word out to the community that says that there may have been, or there was, depending on how certain we are about it, there was an exposure at the AC between the hours of this and this on such and such a night. And for instance, that's what happens when I was doing this work for the town of Amherst. If the UMass contact tracers learned that infected person X was at the Spoke, that bar in downtown Amherst, that seems to be the one they were always at. If they were at the Spoke the day before they became symptomatic, then we got in touch with the Spoke and let them know that an infected person was there between the hours of this and that, at least so their wait staff could be informed. You know, you're kind of helpless about identifying all the other customers, but you get out what word you can. So anyway, in Shutesbury, if something like that came up, it would either be at the church or the school or the AC, and we could put out a community-wide word that said that this happened at this location. So if you were there, get yourself tested.
Right, and
Short of that,
obviously,
go ahead.
I was just going to say, at the church, they all know each other and they would know who was there, and the same with the
They would,
elementary
yeah.
school. And I just wonder
Right.
if we ought to suggest that the athletic club just have people sign in and out, just give their contact information for the nights that they're there, so that they can be informed if there is an exposure.
Okay. Sure. I don't know. You know, I don't know how they would enforce that or what kind of compliance they'd get, but yeah.
Yeah. Well, maybe I'll suggest it to them as a way of kind of
Okay.
just, being responsible,
Yeah.
and see if they're going to do it. Maybe not. Maybe just, give your contact information. And you don't necessarily have to put your times or anything like that, but just if you were there.
Yeah.
Remember, this is the same guy who earlier in one of our meetings said, no, we can't insist on our patrons wearing masks or social distancing.
Yeah, I realize that, but given
It may be a libertarian issue.
you know what I think it is kind of a bottom line issue. They're afraid that they're gonna go under.
Yeah.
Right.
If they don't get
somebody
enough
say
patron.
if we mandate masks that it's going to kill the AC? Didn't somebody say that?
Yeah, he said that.
Yeah.
Right.
Yeah.
Yeah.
Yeah, and he could be right, but I will ask Mark if they could possibly keep a list of contact information for each night, or for each time that they're open, in case of an exposure. And he might say, "Oh, that's not possible," but maybe he'll say, "Yeah, we could do that."
So far, I have not had anyone who said, "Oh, I was at the AC," in my infection period.
Well, that's good.
So far, so good. Yeah.
Arlene, when you have this count of positive cases, are some of them people who were visiting during the holidays from out of town, or are they all residents?
Those are not my cases. The case belongs to the municipality in which the person lives.
I see.
So if there was a family member visiting from Worcester, and after their visit, they learned that they were positive, excuse me, that's a Worcester case.
Yeah.
If that Worcester relative is still in Shutesbury and is isolating in Shutesbury, Worcester would still get it, but what should happen is that the investigator in Worcester finds out that that person's isolating in Shutesbury and should notify me.
Got it.
Whether or not that's really working.
No telling.
It's a very imperfect system. When I find out that a person with a Shutesbury address is positive, but they're isolating in Orange, then it's still my case, but I notify public health in Orange.
Mm-hmm. Okay.
Noreen, you're muted.
Thank you. I have a clinical question, women, Arlene. Is there anything residents or people in general should know now if they get COVID and if things turn a little bit serious for them? Are there any markers or anything that they should be aware of? Fever, for example?
Well, that's not I'm sorry, I missed part of your question, Noreen. Are you asking about general markers for when should a person be suspicious for COVID? Or are you asking
No, I
about
was
when should
thinking
they be
more,
worried about taking it to the next level?
yeah, when should they be
Of
worried about
care.
taking it when can you sit it out at
Okay,
home, and when should you,
sure.
notify, yeah,
The main thing to say is when in doubt, notify your healthcare provider or an urgent care facility. I am not, a public health official is not, as I understand it, I'm not really supposed to be giving clinical advice,
okay,
but rather advice around isolation guidance. So whenever I communicate with people on the phone, I follow up with an email, and if they're willing to give me an email address. And I always say, if you have medical concerns, contact a healthcare provider. But I am here to answer your questions about isolation and quarantine. Nevertheless, I would say that shortness of breath would be the main thing. If people really feel they're having difficulty breathing, respiratory distress, that's cause for probably an urgent, emergency room visit, probably.
okay. Thank you. I just wondered if those things had changed and if people needed to be aware of anything as, as more people are vaccinated and probably are remaining home.
Right. Right. Mainly respiratory distress and, like being really prostrate with just not being able to get up, or people are falling or something like that.
Yeah.
Mobility,
Oh,
serious mobility issues.
okay. Thank you.
So essentially, I mean, the long and short of it is call your doctor if you feel really sick.
Yes,
Yeah.
Sure.
rather
But
than
not everybody.
prematurely overburdening the emergency department.
Right.
Right. Right. Notify your healthcare provider. I just recognize that not everybody may have. It may be that not everyone has a PCP in the area, so they might
Right.
have to go to an urgent care facility. But I don't want to be trying to give out clinical advice over the phone to people in
Right.
town. That's
Right,
beyond
that's
my scope here.
right. Okay. All right. Do we have more on this whole question that we want to pursue? Or shall we go on to related questions? Sounds like we go on. So skipping a thing, Marianne has this idea that the town should buy N95 masks and mail them to everybody in town. Any responses to this?
So
I don't know. I don't really know what she's playing, what idea she has.
and you said something about a budget for that, or could be appropriated from some other budget.
Becky has the money that I guess is CARES Act money, or something like that. She's got money that she can spend on things like she was going to buy some tests just for town hall, for example. So there is money, and I don't know if I suggested that Marianne get in touch with Becky and see if Becky was willing and able to do this. I haven't heard back from Marianne, however, so I don't really know. I don't think that that's what the Board of Health wants to spend district money on. We were talking about using that for testing, for test kits.
Yeah, which seems appropriate to me. The recommendation now, or at least the latest finding, is that anything less than one of the 95 family of masks is not does not provide protection.
Right.
So surgical masks are essentially I don't want to say useless, but they do not protect you against Omicron the way that we assumed they used to be protective.
Right.
So schools in Massachusetts are mandating KN95s where I work in the prison system and other, conjugate living places. They also today mandated the use of KN95 or higher.
So I guess there's two questions here. Do we think this is a useful and effective thing to do for the town to provide N95 masks or KN95 masks to the population and mail them? And are there going to be any available if it
Well,
is a good
that's the
idea?
thing. It's the availability. And you can go online and buy readily. You can buy packages of N95s or KN95s. They are available. Will people do it? I don't know. Arlene, what do you think about the utility of mailing a mask?
Well, I don't know how widespread the need is. I mean, I know everybody needs a mask. In my opinion, everybody needs a mask. But how unmet is that need? Are people unable? If they're unwilling, I don't think mailing them one or two is going to make them suddenly willing to wear it. Okay. But if they're willing, then
yeah.
go ahead.
I think perhaps they are unwilling to invest in an upgrade if they even know about it.
All right.
They're still wearing homemade cloth masks and surgical masks.
Yeah, and pulling their neck gaiters up over their.
Yeah, exactly. Right.
Yeah.
I don't know the answer to, is that a useful expense? Or should we assume, we could publicize, now you really should wear something in the 95 family of masks. And they are available. You could even, I don't think we want to advertise people that sell them. And if you don't have access to the internet, you may have a harder time finding them.
Yeah, and the mailing them to every household is another concern I have. That's a considerable expense. And I just want to give thought, is there another or a better way to do that? Or maybe that is the best thing, to just get them out there in everybody's hands.
If we had neighborhood safety net, we'd have a distribution network all set.
Right.
But boy, I go ahead.
We do or we don't know how many people live in each household. We have that data.
We don't really. It's such a moving target.
Yeah. Right. So that's tricky too.
Right. I think that probably having some, if we had them, rather than mail them out, which seems to me foolish, to just have them available that you can pick up at different places, town hall, the library, the school.
And and even at, if we, I don't know who we is, could access an adequate number of them, they could even be made available at a really nominal cost, which would defray for the town the cost of the thing. And it's a huge convenience for people. I could imagine they would be willing to pay 25 cents for one of them.
Mm-hmm.
Right. Although the logistics of having people pay for them might just be not worth what we got back from it.
Maybe, yeah.
Well, you could just have a can or something there if you wanted to, and people could drop something in.
Sure.
Well, that's a thought. Yeah, by donation, suggested donation.
Right.
One per customer. If you have a family of 5, take 5.
Right.
right?
And town hall is closed though, you know that, right?
Yeah, yeah,
But you can still do some things like buy your transfer station sticker and your trash bags and stuff. So there's got to be I forget how they're doing transactions like that, but
they
there's a
are.
lot of people there's a lot of people I think who would not make the trip to town hall to go get a mask. But so there is some merit to the idea of mailing the mask, but yeah.
Although I would say that if we are going to utilize grant money to purchase either masks or test kits, I'm not comfortable with the idea of even asking people to donate,
Right.
because those are tax dollars anyway.
Right. Yeah. It's
I'm
a
sorry,
little.
you're not. I couldn't quite hear you. You're not comfortable with what, Garrett?
I wouldn't be even comfortable with asking people to donate for a mask or a test kit if we're going to rely on
We're using
tax-funded grant dollars to purchase
Got
them.
it.
Yeah.
Okay.
And is it an either or proposition, masks or test kits?
No, no. There are two different funds here. The Board of Health has access to money that was granted to the district, the health district, and all of that money was dispersed to the district, and they have it. And my understanding from the budget that Charlie and Claudia showed at the district meeting was that there's about $7,000 in our part of that budget that hasn't been spent. And what we had talked about previously was using that money or some of it for test kits to distribute to town residents. So when Marianne said, how about buying N95 masks for everybody and mailing them out, I said, with money that Becky controls. And she said, well, what money are you using? And so I explained that to her. And so I referred her to Becky to see if CARES Act money could be used for these masks. And that wouldn't have anything to do with any budget that we have. That goes all through Becky and the select board.
And it may be that that's not an allowable expense, because you can't use, my understanding is you can't use the CARES Act funds to purchase the test kits. So it may not be an allowable thing, but it's worth checking.
Okay. Okay, so Charlie says that the funds that we got from the state can be used for test kits. Would be interesting if CARES Act money isn't available for masks. One thing that strikes me as a possibility is if people are interested in getting these masks. I mean, we don't have neighborhood safety net because people didn't want to invite their neighbors into their home, and I couldn't get them to organize. But we could, I mean, if we hear from people in a particular neighborhood that they're looking for them, we could ask somebody to, give those masks a home on their front porch or something, so that people could stop by and pick them up outside. And we could have, dispersed distribution.
Good.
Here's a tangential question that I just wanted to ask about. Arlene and Wim, you might know the answer to this. if people don't have N95 or KN95 masks, is double masking of other kinds of masks effective?
I don't know.
Well, it's more effective than a single layer. So
Right.
I think I read, I don't remember where this advice was coming from. It may have been the CDC saying the N95 family, barring that, then at a minimum wear 2 layers of other mask types.
Okay. Okay. Well, we ought to have some messaging about that, I guess. All right. Well, it sounds like the sense of the meeting is we think that it would be good to acquire some of these masks if possible, if the CARES Act money covers them, and try to get them out. So I'll look into it and see what's up.
We could also,
Yeah.
we could use a couple of different distribution points if we're not going to mail this out to every household, such as library curbside pickup, the elementary school nurse providing them to school children's families. I'm just thinking about, who are our allies in the community who could be part of a distribution network.
We could certainly give some to the police department to have to distribute as they're doing their work.
Right.
It's part of community policing.
And if we are to purchase them, we should purchase some that are meant for children and not just all adult size.
Good point. Possibly the church.
Mm-hmm.
They aren't all that friendly to us, but they are, pro-social anyway.
Hey, the AC.
Yeah.
I mean, I'm kidding, but.
Well, no. I mean, if they had them there, people might not wear them there.
Them,
yeah.
Right. And
yeah, totally.
Of course, not everyone who comes to either the church or the AC. Not everyone is a Shutesbury resident, but I don't know if we want to.
I don't think we need to care about that.
Yeah.
Yeah, and post office, library, I mean, anywhere where people go for some service.
Yeah.
We could even give a couple to that guy at the post office. Maybe he can start there.
Yeah, fat chance. However, it would be possible to have some there, for distribution. We could say, look, Chuck, offer these N95 masks to protect people from you.
Right.
Yeah.
If the funding's there to purchase the masks and the kits, I say we go for it.
Everybody of the same mind?
Yeah, absolutely.
Yeah.
Okay. So as far as the tests go, we have to use the state contract, and it's fairly complicated and difficult. And I think the deal is that Becky basically has to do the ordering, and then the town gets reimbursed. from the district. I'm having a little trouble pinning anybody down on this, but I'll see what I can do tomorrow. And I will also look into the situation with masks. Okay, any more on that?
Not for me.
Everybody has said their say?
Hmm.
Okay. So you've seen from the notes, we've got a septic system repair on Wendell Road, and it's complicated. And in fact, all we need here is for you guys, I mean, that we ought to just get it out of the way, to agree that when all their requirements are met, which is to say we get all the payments and the signed application and Charlie's agreement, which I believe he's already given, that I can issue that permit. Is there any reason that anybody would want this to come back before us? I guess that's the question. Are you willing to vote on it now, or do you want it to come back? It can come back. I mean, they're not in a hurry.
It doesn't have to. If I read it correctly, there was a faulty inspection, but now everyone's on top of it, right?
Yeah.
Yeah.
It's fine by me that it be issued when requirements are met.
Okay.
I agree.
Anybody?
Also,
No?
yep.
Okay. All right. When that's all sorted out, I will just go ahead and issue it. We won't have to think of it again. So the last thing is this business of the potential well impact of the solar project. And oh my goodness, there's so many things to say about this. To start off with, we are not competent to make this kind of assessment, to predict potential damage in the future by an unspecified and unbuilt project. And this is way outside the scope of our expertise, right? Don't we all agree on that?
Yeah, it seems to me there are two standard things we always recommend, and that is test your well. And, if you're able to get a deep well dug. I mean, those are our consistent recommendations.
Right. Yeah. I mean, this guy says, our dug well, our 10-foot, my God, dug well has worked fine for 30 years. But you're right. We do always recommend drilling a well down into bedrock and sealing it from, in whatever incursion from the groundwater there might be. And clearly off on Montague Road, it's been rural and wooded enough to make that work for him, but maybe not anymore. Or now that civilization seems to be coming to the area. So I wonder who recommended this, that he ask us for advice on this. Maybe we can find out.
It seems to me this is more in the realm of Concom.
Right.
Isn't it?
I guess so. I guess so. I guess that, I mean, I'm not quite sure I understand the issue here.
Well, actually, no, they would be involved if a sensitive area was, if installation was proposed in a wetland.
Right.
And they don't get involved with every case of taking trees down, right?
I think that's true, except when they're really big ones. And I don't know to what extent they're involved in the discussion over these solar shields. Right. But so really the question is, if he wanted to find out, and if he wanted to have somebody look at where his well is and where everything is, and give him their judgment on it, which we're not going to do. I'm thinking that that might be perhaps a well driller. And I think he's going to have somebody come in who knows this stuff. I don't know if maybe somebody like Alan Weiss could give him an idea, but I guess the thing is, I mean, I'm not even sure what the issue is here, is that presumably you guys read his email. Is it that when the land is cleared up there, he expects that it's not going to have the same buffering capacity for the rainfall, and that it's going to swell the creek, and the creek is going to overflow into his facility, or what?
I mean, that's how I interpreted it.
Uh-huh. Is that, I mean, I don't even know if that is.
I mean, there are DEP rules and regulations related to wetlands and ground-mounted solar installations.
Right.
And then that's where I think the Conservation Commission gets connected into, to Arlene's point.
Right, but presumably there's not a wetland involved in here, in this particular case.
Would the brook not be considered?
I don't think a brook per se is considered a wetland.
I think it is.
You do?
I think it is.
Yeah, because that's specifically what Concom addresses when they demand one of these RDA studies. If it's within, there's a specified footage from a stream or wetland.
150
Right.
like that. Yeah.
But that's definitely Concom's purview.
Okay, well,
Is there such a thing as a NIMBY engineer?
Probably. There probably is, but I don't know any personally.
Oh.
So I'm thinking that the things we have to tell him are, one, the Board of Health is not competent to do this.
Absolutely, because it's not even clear. I agree. It's not even clear what the question is.
Yeah. That he should get his well tested as a baseline, essentially.
Yeah.
That we recommend getting a deep drilled well. That it could be under the jurisdiction of Concom. Now, it may be that Concom told him to get in touch with us. Who knows? I'll see if I can find that out.
I think that there has been a next door string on this topic.
Uh-huh. What can you tell us about it?
I'd have to go back into next door, but I seem to recall a string on next door specifically talking about this parcel.
Mm-hmm.
And Kat, I would just suggest that I think all your points are right on, but I might not use the word recommend when you're referring to the deep well that we recommend. I would say instead that deep wells are known to prevent groundwater from contaminating your drinking water source. But I don't know that I would recommend it to them.
Well, perhaps. Well, I mean, we have a history on this. we have encouraged, let's put it that way, we have encouraged people to drill.
All right.
And I can tell them that historically the Board of Health encourages people to drill wells because of,
It's
bedrock.
safer. Yeah.
Yeah, right.
And
And
we
and
could
explain that.
we could point them to the DEP private well guidelines.
Okay. And do the DEP private well guidelines privilege deep wells over shallow wells?
So I talk like I know what I'm talking about, but I had to research this today. So Google told me read the DEP private well guidelines. And so I'll send you the link, Kat, and
Okay.
it specifies the things that really should be true for a deep well. And given that in the communication from this individual, they said that it sounds like this is a 30-plus-year-old deep well.
Shallow well.
So,
Well, dug well. I'm sorry. That it probably isn't to the current specifications.
Ah. That's an interesting thought. Okay, yeah, I'll take a look at that if you'll send it to me.
Yep.
Okay. All right. It seems to me that there's kind of a lot to do as the post-meeting stuff. I wonder if I can give a little bit of it away. I wonder if there's somebody who will try to work with Becky on the rapid tests purchase. And if there is somebody that, maybe the same person, that would also look into the masks business with Becky and Marianne and whatnot. Are there any volunteers for these jobs? And I'll be working on the well guy and the message. And
yeah, I can definitely, let me give Becky a call, and I'm happy to do that. See if she needs any assistance
right, because we
going,
haven't told her what we want or where we want to get it or anything like that, because I haven't made that kind of contact with her yet. So I will send you, Wim, I'll send everybody actually there is an email explaining this whole setup where we are able to use the state contract and get the state prices, and we have to go directly to the manufacturer to get the tests.
Okay.
So I'll send that to you.
All right. And Becky and Marianne have already talked about the mask issue, you think?
I don't know. It sounded to me like Marianne was going to do that, but neither of them has gotten back to me.
All right.
And so what we would need with Becky, as far as the test kits go, are look at the manufacturers, pick some tests, see how many we can afford, and get Becky to order them for us.
Right.
That's assuming that the town credit card is in good order and can actually do that stuff. If not, we might be able to get the district to pay for it direct somehow, but I'm not sure exactly how that could happen.
I don't think that worked out last year, Kat.
Well, I don't think it did either, but we'll just have to see.
Right. I think last year when I was getting 10 swim, I just got all the information and specifications to Becky, and then she did the ordering. So I think it's a big help for her to just give her the specs on what you want.
All right.
Right, yeah, she can't be expected to
Right.
like pick it out.
And I guess you probably know this, Wim, but I think some of the rapid tests aren't as sensitive when it comes to Omicron as some of the others. You probably know more about that than I do, but I've read
Nope.
something about that.
No, I don't. But I can learn.
Okay, that's what I had read somewhere, that some of them are not as sensitive.
So I think through the state
Oh,
contract, there are 3 vendors that,
Okay.
3 test kit vendors that you can select from. And then there's obviously variability in price and all of that, but
Noreen, if you have a source for that information about home test kits and sensitivity to Omicron, if you could share that with me, I'd appreciate it.
Oh, yeah, I don't remember what they were. I just remember reading actually an article about it. So
Okay, I'll try to find out.
that's what it came from, and I just remembered that there was some indication about that. So I don't have a source, unfortunately.
Do you remember where you read it?
No.
It's okay. Yes. All right.
I am having trouble finding the information about buying test kits on the state contract. I thought that you sent that to me, Arlene, but I'm having trouble finding it.
I believe I did too, but I will. I'll look for it in the next day or so and get back to you. Okay.
Okay, that'd be great.
Is that different from what I sent you, Kat? Is it a different?
I believe it is.
Okay.
The thing that you sent me was for tests that we would administer ourselves. And the thing that Arlene sent me was a newer thing that was about tests for distribution.
Okay, good.
Yeah, it was a press release, if I'm not mistaken.
Right.
I'll find it, Kat. Yeah.
Okay. Yeah, I'll also look on DPH and see if it's on their website.
I think if I remember correctly from a call this week that there is a webinar maybe tomorrow for local communities on the purchasing process.
Oh.
I'll look at some notes to see if I can find the details of that.
Okay, that would be great, because if I would do that if I know it. Okay.
Just one other idea, if that doesn't work out, is the I think on my email, I think there was a reference to there's a purchasing person at FERCog, and they might be able to help with some questions too on purchasing the test kits. But
okay. All right.
So I just found the information about this webinar. It is tomorrow from 1 to 1:45, the Operational Services Division. So I'll send this to the Board of Health email.
Okay.
There's a registration link too.
Thank you. And then if we can find the press release,
Yes, I
about
will
the
look
other
for
thing.
it. I will resend it to you, Kat, at Board of Health.
Okay. Okay, are we all set?
I guess I should, for the record, just mention that, speaking of Becky, she got in touch with me a couple of times this week about town employees who are positive, and she had questions about what she wanted to require a negative test to return to work. And she was seeking input on that, and also on rewording of the town employee COVID policy. So related to the first thing. So I did provide some wording advice for her, and I also described to her why, what the rationale is for DPH not encouraging the requirement of a negative test for return to work. You know,
Right.
The whole
Yeah.
potential persistent positive on especially a PCR. But that if she really felt like she needed to or wanted to require a negative test, that a rapid antigen test would be the one to require, because they don't persist positive for as long. So I did provide that advice to Becky this week.
Yeah, she mentioned actually to me that you had sort of completely revamped the policy, and she was very pleased.
Which is a select board policy, it's not ours.
Right, exactly.
But I gave her just some suggestions on rewording. Now that the CDC and DPH have downsized an isolation period to 5 days of strict isolation instead of 10.
Right.
Yeah.
Okay. Okay. Anything else we need to talk about?
Jill?
Oh,
No,
I think we're all good. We've only been talking for an hour, but that seemed like a really busy hour, didn't it?
it did.
Okay, well, thank you all, and I expect to hear from various ones of you about various things in the next day or two.
Okay.
all right. Thanks.
Okay.
All right.
Well,
Thank you.
Happy New Year, everyone.
Yes,
Happy
happy
New
New
Year.
Year. Drive
safe,
safely.
Arlene.